Okay, great. So yes, my name is Bella. I'm currently undertaking research looking at improving the way health and social care professionals identify and respond to victims of domestic abuse and modern slavery. Today, I want us to have a look at domestic abuse and modern slavery, what they are, their global burden and individual impact, and look at how stigma relates to victim identification. So first we'll look at what we mean by domestic abuse. So there are many definitions in literature, variations in how it's conceptualized across countries, cultures, laws, but the United Nations suggests that it's a pattern of behaviors and relationships that used to gain or maintain power and control over an intimate partner, either current or former. It might include children or other relatives or any other household members, and include any behaviors that frighten, intimidate, terrorize, manipulate, hurt, humiliate, blame, injured, or wound someone, regardless of their age, race, gender, sexual orientation, faith, or class. So quite a broad and comprehensive definition there. And domestic abuse will include anything from physical violence, sexual violence, emotional abuse, psychological abuse, financial, economic abuse, and stalking. I think this power and control wheel is a useful tool to think about the overall pattern of behavior which are used by an abuser to establish and maintain control over their victim. Very often one or more violent incident will be accompanied by an array of the other types of abuses which aren't so easily identified, but they establish the pattern of intimidation in a relationship with control and power at the center of it. So one of the things that makes it hardest to provide even an estimate of global prevalence is the vast variation in how it's defined, but also vast high levels of underreporting and underrecording. I wanted to include a really nice map of global distribution, but actually I couldn't find anything comprehensive. But this begins to give a flavor of the magnitude of the issue. So the World Health Organization suggests that 1 in 3 women throughout the world will experience physical or sexual violence by a partner or sexual violence by a known partner in her lifetime. There's actually a real paucity of statistical data, global statistical data regarding men who are victims of domestic abuse. Men are significantly less likely to report, we know that. There's much more stigma around that, and there's more acceptance in society of aggression towards men as well. We have a little bit more comprehensive data that comes from the UK. So my study, my PhD study is based within the UK. So these figures are really sort of relevant to me in particular. So for example, it suggests that 5% of adults experienced domestic violence in 2020, and police records showed a rise in reported abuse. And we're estimating that for every 3 victims of domestic abuse in the UK, 2 will be female and 1 will be male. Now we'll just move across and have a look at what we mean when we talk about modern slavery. And there's no single definition of modern slavery in international law. It's kind of dealt with by an umbrella of terms. It's an umbrella term, and then it's dealt with by a complex puzzle of treaties, conventions, protocols. Makes it quite difficult to have a coordinated response to what is obviously an international and global issue. Some countries have developed their own anti-slavery legislation. So in the UK, we have the Anti-Slavery Act 2015. But again, this definition from the United Nations is quite a useful starting point. So it thinks of modern slavery as something that refers to situations of exploitation, a person that can't refuse or leave because of threats, violence, coercion, deception, and or abuse of power. Some of the most common types of modern slavery are sexual exploitation, human trafficking, forced labor, bonded labor, organ harvesting, domestic servitude, forced criminality, and forced marriage. We have quite a lot of statistics actually about modern slavery around the world, even albeit we assume that those statistics are vastly underestimating the problem. But it's suggested that around 50 million people are victims of modern slavery in the world. Between 2016 and 2021, the number of living people increased by 10 million, which suggests that it's a problem that's really rising. And women and children are disproportionately vulnerable. North Korea tops the list of countries with the highest rate of modern slavery. 1 in 10 people is living in modern slavery in North Korea, and the majority of them are in state-mandated labor. A lot of the countries with the highest estimated levels are also marked by conflict. So Afghanistan, Pakistan, Eritrea, they kind of top those lists. In the UK in 2020, there were 10,000 potential victims identified. And even though we think of modern slavery often as a kind of international trafficking issue, actually, of those people, over a third were UK nationals. So why do we think about those issues kind of together? Why to consider domestic abuse and modern slavery at the same time? So abuse, coercion, exploitation, power and control at the very heart of both of them. They're largely hidden and lead to an underestimation of prevalence and poor understanding of the impact. In the UK, they're both included categories in adult safeguarding. That means there are legal duties that mandate action from professionals. And they challenge the fundamental human rights to life, liberty, and freedom from torture, degrading treatment, and slavery. There's a large overlap in the impact that domestic abuse and modern slavery have on health victims and survivors. So acute physical injury, chronic illness and disability, there's a much higher risk of that. Mental health issues, most commonly on both sides, anxiety, depression, and post-traumatic stress disorder. Harmful use of substances, both as a coping mechanism or forced use as part of a pattern of abuse. So we know that women who experience significant physical and sexual violence are thought to be twice as likely to have problematic use of alcohol and 8 times more likely to have a drug dependency than women with little to no experience of abuse. Sexually transmitted infections are a common problem. Maternal and childcare issues such as repeated miscarriages, and reproductive health issues. And there's really a unique opportunity for healthcare professionals to identify victims. It's estimated that nearly 500,000 victims and survivors of domestic abuse in the UK seek assistance from medical professionals every single year. And a US-based study found that 87.8% of female survivors of trafficking reported that they were evaluated by a medical professional at least once while they were being trafficked in emergency departments, sexual reproductive health services, and women's health clinics, but professionals still miss or fail to respond to signs of abuse. So just quickly consider what we think about when we're thinking about stigma in relation to abuse. The dictionary definition is a mark of disgrace associated to a particular circumstance, quality, or person. But really, we're thinking about the negative attitudes or discrimination against someone or group based on characteristics that are perceived to set them apart from others in society. And the impact is that on both victims' willingness to come forward, but also health professionals' ability to spot the signs and adequately respond to them. And so these are some of the ways in which stigma can manifest itself in relation to victims of abuse. Each aspect can have impact both on likelihood of disclosure from the victim and likelihood of identifications from professionals. If I just kind of go through the list, the victim blaming can manifest itself as internalized stigma on the victim's part, like there's something wrong with them, they deserve the treatment that they're getting. Professionals might be thinking, why doesn't the person just leave? They've got themselves into that situation. Then things like abuse as humiliation, so victim feeling ashamed and embarrassed to talk about their experiences, professionals thinking that if a person wants to talk about it, they will just speak up. Lack of knowledge, so victims not realizing that they're living in an abusive situation, feeling that other people have it worse. Professionals thinking that there's no signs of physical abuse or any marks of bruising. And then harmful norms. So cultural expectations to live with, put up with things. Certain behaviors are okay in certain cultures from the professional side, so we mustn't interfere. And you can see there's a lot of shame, fear, and anxiety caused by stigma that leads to reduced disclosure and a lot of unhelpful, harmful assumptions on the part of professionals that result in reduced identification. So my study really focuses on trying to improve identification in telemedicine context, so services which are being provided remotely without face-to-face contact. There's been a significant increase in remote provision in health and social care during COVID-19, and now it's becoming more and more part of routine provision. And I'm focusing, my starting point is sexual and reproductive health services. In the UK, we already talked about the link between domestic abuse and modern slavery and sexual reproductive health, but it's also one of the few types of services that people living with this abuse will access or be allowed to access. Poor knowledge and stigma and lack of appropriate tools are impacting professionals' ability to identify victims. Professionals are telling us that, and we know that the identification rates are just not good enough. So we're looking at developing a tool that will aim to address some of these challenges, enable conversations about the topic, which can still be seen as taboo, looking at how routine inquiry can challenge stigma by normalizing questions about abuse and exploitation, giving professionals confidence to ask and respond appropriately, knowing what to do with a serious concern or disclosure, creating a safe space so when people are ready to disclose, they know they're not going to be judged and that appropriate support is going to be available to them. And if we're considering stigma as something that occurs as a result of othering, a division between us and them, then research of this kind has potential to enhance that divide. And one of the ways to mitigate that is by co-producing the research with people with lived experience. So my study is aiming to be co-produced with people with lived experience from the design stages all the way through to the dissemination of the results. So yeah, just to conclude, domestic abuse, modern slavery, affecting millions of people the world over, can't be separated from the public health implications. We need to do a lot more research to improve our understanding of domestic abuse and modern slavery. If we're to improve identification and provision of appropriate support, we must tackle the stigma that's associated with the abuse. And education for the public, but for health and social care professionals in particular, is essential so that they are able to spot the signs and provide effective support. So these are just some references that you can see when the slides are circulated. Thank you for listening. And these are my contact details should you wish to discuss anything further. Thanks.